Alrighty, well, good afternoon, everyone, and welcome to the June Behavioral Health Advisory Group meeting. Very glad to have you on for this month's BHAG meeting. Looking forward to our meeting agenda, and as I mentioned, I hope everyone is staying dry. I do apologize if you see some flickering lights on my end. We are having some thunder and lightning here in Anne Arundel County, so hope everyone is staying safe, and thank you again, everyone, for joining. And if you need to hop off at any point today, the meeting notes and the meeting recording will be sent your way. So no worries if you lose connection with us. So to start this afternoon, hopefully thinking of some more sunny days, some of our summer activities coming up for our Mindful Minute. If folks wouldn't mind introducing yourself with your name, your organization, and what is one summer activity you are looking forward to the most? Anyone have any fun summer plans they'd like to highlight? Nina said reading on the beach. Could certainly use some of your recommendations. Larry said going to Bethany Beach.
I'm going to narrow down to where Larry said reading on Bethany Beach.
Wonderful. Well, hope we get to some better weather, some sunny weather, so we can enjoy the beach. Oh, wonderful. Going to Afro Beats in Portugal. Wow. Courtney, Rehoboth Beach with family and friends. So I'm sensing a BHAG meetup in Rehoboth Beach and in Bethany Beach. And possibly a meetup in Portugal. Miss Cheryl, I see you have here in the comment evening jazz at the National Harbor. Is that something on a weekly basis that they have?
Oh, let's see if I can unmute. Am I muted? Can you hear me?
We can hear you.
Oh, okay. It's used generally once a month.
Wonderful.
Right. It's real nice. The water.
Yes, thanks for putting that on our calendar. We've got beach vibes in Jamaica, tennis.
Wow.
Awesome. Awesome. Well, certainly hope that we can have some nicer weather coming your way so everyone can get out and enjoy themselves. Anyone else want to do a quick introduction? Alrighty, well, we will go ahead and move into our meeting agenda. So excited today to continue with our BHAG partner presentation series. So for those who may be joining us for your first meeting today, a few months ago, when we were planning for the new year for 2025, we were talking as a group how we can continue to build connections in this virtual space. How can we better connect mental health providers so we are aware of one another and the services that are provided across the county. And the group came up with this idea for these 5-minute partner presentations. So each meeting, we have 1 to 2 partner presentations from a BHAG member where they get to highlight their services and then also how they can support the BHAG and how they would like the BHAG to support them. So an awesome opportunity to get to know your neighbor a little better here in this Teams environment. So excited to have our June presenters up today. Then we will transition into a mental health policy update session. Did a little bit of research to figure out some Senate and House bills that have recently passed in the Maryland General Assembly. Wanted to do a quick update with you all so we can track some of those, see if there are any that we would like to follow up on to see their impacts on Prince George's County. So we'll do that here shortly. And then, as always, we will wrap up with our community announcements and upcoming meetings. Alrighty, well, with that being said, I am honored today to get to invite Melanie Stargo up to talk about Anchored Counseling and Consulting LLC. So Melanie, would you like me to share the slides from my end, or would you like to share from yours?
Whatever is whatever's easier, I can do it.
Okay, I will go ahead and stop sharing.
Thank you, thank you. Okay, make sure. Okay, there we go. Can everyone see my screen?
We can now.
Yes. Okay. Okay. Hi, everyone. I see some familiar faces and familiar names. Welcome to a brief presentation about anchored counseling and consulting, where healing is an art. And I'll talk a little bit about that. So again, my name is Melanie Stargell. I am a licensed clinical professional counselor in Maryland and the owner of Anchored Counseling and Consulting, which is a private practice that really utilizes expressive arts and creativity in the therapy space. A lot of times we talk about the very traditional talk therapy, and in my work that I do, we still talk. But I absolutely love bringing in expressive arts. And I'll talk a little bit about what that is and what that looks like in the upcoming slides. Anchor Counseling and Consulting offers individual therapy, both virtual and in person. I have an office in Lanham, right off of MLK, right by Vista Gardens. So I see clients both virtually and in person. Virtually, if they are located physically in Maryland. In person, if their home is in DC or Virginia, as long as they come to the office, we're good. But if they're virtual, they have to be located in Maryland. Therapeutic expressive arts, trauma recovery support, family counseling, support groups, workshops, and yoga classes. I am a certified yoga instructor, so really bringing in that mind-body connection. And I do accept insurance, Blue Cross Blue Shield, Cigna, Maryland Medicaid, and United Healthcare. And I see both children and adults. So you may say, like, why expressive arts? What is expressive arts? Expressive arts really is just the utilization of journaling, meditation, anything creative in the therapy space. A lot of times we are very logical, or let me at least speak for myself. I'm very logical. 1 + 1 has to equal 2. So getting into creative arts taps into the unconscious. It taps into the nonverbal way to explore what is happening and what is going on. So again, collaging, painting, journaling, movement, sculpting, scribbling. I brought GIMP in a session. I don't have mine, but like, back in the day, we used to have GIMP, bracelet making, and all of these different things. Expressive arts is evidence-based and accessible for all ages and backgrounds. A lot of times as we get older, we are not as creative as we were when we were kids, but there's absolute beauty in being an adult and being creative. I also support justice involved and justice impacted communities. I am a native Prince Georgian, have lived here for the most part my entire life. I graduated from Bowie State with my master's in mental health counseling, and I have worked across many intercepts. I was a correctional treatment coordinator for Prince George's County Department of Corrections. I was the problem solving courts coordinator for adult mental health court and adult drug court. And most recently, I was a policy analyst for the Council of State Governments Justice Center. And so I've done a lot of work in the intersection of the criminal legal system and mental health. And so my goal really is to support justice involved individuals as well as justice impacted, because we talk a lot about the individuals who are in the system directly, but sometimes we don't find ways to support the family and the community in the ecosystem. And so I provide individual and group therapy for justice involved individuals pre and post release, the families, community outreach. And I really want to be able to bring expressive arts to correctional settings, to our justice settings, but just to the community in general. Healing, in my opinion, really is an art. And so to be able to bring that is really important to me. And so I would love to connect and collaborate. I am currently accepting new clients, children and adults. I would love to be able to support offering low-cost group offerings through grants and partnerships, bringing expressive arts into the community, and collaborating with schools, organizations, behavioral health programs. I will be working with a nonprofit as well to do some consulting and collaboration with justice involved and impacted individuals. And so I am definitely here as a resource and as a referral source. And my contact information is down below, the website, my phone number. And I also gave Taylor a PDF of all of this. Well, shortened version. I can probably drop it in the chat as well. And so again, I am here, and thank you all for letting me have some time with you all today. And it's good again to see some familiar faces and some familiar names. And if you are speaking in the chat, I can't see it. So I'll stop sharing and then I'll check the chat. But thank you all.
Thank you so much, Melanie. I'm seeing a lot of hand claps, a lot of hearts. Any questions or any comments for Melanie?
Hi, Melanie, this is Elizabeth. How are you?
Hi.
Hi.
Wow.
So, I'm very excited that you're doing what you're doing, and I would love to introduce you to Sherry Cox in the Returning Citizens Affairs Office. So, just to be a part of that ecosystem you're talking about, I'll do an introduction, and we can take the conversation from there. But welcome back.
Thank you. Thank you, Dr. Pocono.
Yes.
Any other questions? Alrighty, well, thank you so much, Melanie, for joining us today. I will be sure to get out your meeting slides as well as the flyer you have provided. So anyone who is interested in further connection, feel free to do so. Melanie, if you also want to pop your contact information in the chat so folks can note that if there's anyone who's needing to plan a follow-up with you, that would be very helpful. And I am going to go ahead and put here in the chat if anyone is interested in scheduling their partner presentation. We have some slots available next month in July and a few throughout the remaining months. So feel free to sign up via that link in the chat, and you can come and give a brief presentation about your organization. And as you saw today, be able to do what the BHAG does best and build these connections. Alrighty. And so again, if anyone is interested, here are the parameters for the meeting, for the presentation, for your brief partner presentation. So highlighting your organization services, populations of focus, opportunities to engage with your organization, how can the BHAG support you, and then also how can you support the BHAG. And then always continue to share any materials you would like us to get out to the community, and we are happy to do so through the coalition and through our BHAG volunteers. Alrighty, and with that being said, we're going to go ahead and transition to our second presentation today that I will be facilitating. So for those who were able to join us last Tuesday evening for the Prince George's Health Action Coalition quarterly meeting, we facilitated a discussion with our Chief of Health Policy and Innovation here at the Health Department. Sorry, the thunder is going to interrupt me many times. So our Chief of Health Policy and Innovation from the Health Department, she came and she spoke to our coalition at large about the legislative process. So how to introduce a bill at the state level, both in the Senate and the House, and then how that process looks at the local level as well here in Prince George's County with our county council. So she gave a really great overview. I'll be happy to share those slides with members on the BHAG as well, so you all can take a look at those different resources for anyone who may be interested in getting more engaged in policy or legislation. Being that, you know, we may not be in that integral policy season at the state level, there's still time. It's still significant time now as an organizing group to organize ourselves to see if there are any policies that maybe didn't get passed this session that we want to take a look at, or to see if there's anything that the work groups would like to advocate at the county level or again at that state level. So today I'm just going to do a quick recap from the Maryland General Assembly. So again, this is going to be at the state level of some House and Senate bills that have been passed and have actually will have a soon implementation date. So the governor has signed them into effect, and they will be implemented between, there were some that have been already implemented come June 1. A lot are going to be starting to be implemented July 1, and then many are coming in October. So wanted to make folks aware of these different policies to see if anyone had any questions specifically that we could have a discussion about. And then also to see, again, what do we want to pay a little bit more attention to as it relates to its impacts on Prince George's County as in the mental health sphere. You all know this content very well, and some of these mechanisms that a lot of these policies impact. So I want to have your perspectives. If this is impacting any of the work that you're doing, would love to hear from you today. But otherwise, we're just going to go through a few Senate and House bills. Again, this is going to be conducted at the state level. So a lot of time, whenever I'm talking about, different work groups, you have to imagine that most of those will take place at the state level. An important distinction to make whenever you see SB versus HB, that's going to be a Senate bill versus a House bill. So you will very soon see that distinction. You'll also have access to all of these slides. I'll also provide you with some resources at the end if you'd like to take a deeper dive at some of these policy resources. I am certainly no policy expert. I am merely just someone with Google, with a search engine. So I did really quick research into some of these Senate and House bills, but again, feel free to take a deeper dive after this meeting. So with that, we'll go ahead and jump into this was Senate Bill 372. This was a bill to preserve telehealth access. So there was a time limitation that was set to expire June 30th of this year. So that time limitation has been permanently removed. And that time limitation was on telehealth reimbursement and coverage requirements. So that time limitation has now been permanently removed. And this bill now also mandates that all services delivered through telehealth must be reimbursed at the same rate and on the same basis as in-person services. It also mandates the same standard of care for telehealth versus in-person healthcare services, including clinical evaluations and referrals to in-person care when clinically appropriate. Specifically in the mental health sphere, it places restrictions on prescribing certain Schedule II opiates through telehealth services. So those are just a few notes regarding the Preservation of Telehealth Access Act of 2025. But again, there will be additional links so you can all read through the legislation yourselves and see some of those nuances to see how it may or may not impact your practices. But any questions or any comments based on Senate Bill 372? And I'll just quickly add, a lot of times you'll see that when you have access to these slides later on, you'll be able to, the legislation is hyperlinked. So if you click on the title up here for Senate bill and the House bill, it'll take you to the Maryland General Assembly. So you can see the progression, you can see the full legislation, you can see the full bill in its entirety to read through all of its nuances. And a lot of times you'll see that the bills were cross-filed. So in this case, it was cross-filed as a Senate and a House bill. So that's why you see those two numbers. But if you're ever searching up, you'll be able to find the same information if you're looking up the Senate bill number or the House bill number. So next we have Senate Bill 310. So this bill updates the state's existing law to recognize gambling addiction alongside drug and alcohol use as potential contributing factors to youth suicide risks. So it requires suicide prevention programs for youth to now include instruction on the relationship between gambling and youth suicide. So I thought this one was particularly interesting. Earlier in the year, we heard from the LBHA and how they are managing our suicide prevention and education coalition. So very interesting here, talking about for youth and being able to now being mandated to name gambling as an associated risk factor for youth suicide. So certainly something that we will be paying attention to and seeing its impact at the local level and some of our suicide prevention efforts. Any comments, reactions, or questions to Senate Bill 310? All right, next we will jump into House Bill 1066. So this bill requires the Commission on Behavioral Care Treatment and Access to create a new work group. So this work group specifically will conduct an evaluation of substance use treatment and recovery support services. It will also analyze the impact of criminal justice involvement on individuals with substance use disorder. So it's going to be paying attention to, again, the impact of substance use related criminal justice policies on individuals and communities. So I thought this one was especially interesting and relevant to this work group because I know, in the past, many of our efforts have been organized around the mental health needs of justice involved individuals. So especially with this coming from at the state level, now seeing this work group, we'll be very curious to see their recommendations moving forward and the results of the work group. There likely will be a report that will be coming out that will be mandated probably by the end of the year, if not in early 2026. So as soon as we learn more about this, we will be sure to share it with the work group. But again, something relevant and something that can be brought back up to the BHAG specifically. Any questions or comments about House Bill 1066? All right, next we have
a question, Taylor.
Yes, go ahead, Nina.
And I might be getting ahead of myself, but is there any indication of how members of the work group will be selected?
So they did have, and I'll provide you a link to the specific legislation. They do have some mandated members of who will be needed within, who will be required to be active within that work group from the Maryland Department of Health. I haven't seen any mandated representation at the jurisdiction level, however.
Okay, interesting. Thank you.
Absolutely. But something, again, I'm inquiring more about to find out if sometimes a lot of these work groups are already in place before we even see the policy in effect. So that may be the case in this situation. I did see it for another policy that was just recently passed. But I will keep you all updated if there are any opportunities for any involvement in any of these work groups that are mandated. You'll see a lot of the legislation that is passed. Many of these bills, they do require new work groups to be established at the state level. So something for us to pay attention to. Any other questions? All right, we will jump next into Senate Bill 696. So this bill expands the Maryland Mental Health and Substance Use Disorder Registry to include private and state mental health services. So wanted to make that distinction. I know we have many private providers who join our monthly calls, and so that was a specific nuance to this bill that I wanted to call out. This bill specifically defines a pediatric hospital overstay patient as a patient under the age of 22 who remains in the hospital for more than 48 hours after being medically cleared for discharge. So it now requires that the Maryland Department of Health and the Department of Human Services work together to ensure patients are transferred to the least restrictive setting. And it also establishes another work group, a work group on children in unlicensed settings and pediatric overstays. So this will be, again, another opportunity to take a look at who is required, who is mandated to be a part of this work group, and to see if there's any opportunity there for representation from Prince George's County. Any questions or comments based on Senate Bill 696? And as I've been going through, I made sure to highlight here so you can see that these first bills that we've gone over, these have all been signed by the governor and will take effect very soon. So some of the previous ones you've seen, most are between July 1st and October 1st.
It's Prince George's, some advisory committee going over bills that, anyway.
All right. So next we have Senate Bill 589. So this bill requires the Maryland Office of Overdose Response with the Maryland Department of Health to develop and maintain an interactive online dashboard about the opioid restitution fund with specific state, county, and municipality information. So that was something that I really wanted to call out here, is that that interactive dashboard will now have to include information, again, at all three levels, so folks can have access, on-demand access to that information, again, at the state, local, and municipality levels, that they'll be able to see, as you can see here, the payment schedule information on estimated payments from opioid settlements, past spending of settlement funds, spending plans and priorities, and detailed descriptions of any initiative funded with settlement funds. So again, this is an effort for greater transparency as it relates to the opioid restitution fund, and a way for more folks to have access to this information, again, at all three levels, to see what is happening, how that money is being spent, and any information as to the funds that may trickle down. Any questions based on Senate Bill 589? And I'm curious, Nina, if there have been any updates. I know the behavioral health division recently, well, not too recently, but Sammy has joined us, and was her role primarily working with the opioid restitution fund here in Prince George's County?
Yes, she is the manager, the program manager for the opioid restitution or opioid abatement funding. I'm not sure if I don't think she's on the call today.
Gotcha. Okay. And that was something that I took note in, looking over this bill in particular, as a way to, have future conversations with, if it's members of the health department or members in our community, again, to see how are some of these policies at the state level, how are they trickling down to us here in Prince George's County, and what impact is that having on our work?
Absolutely. And she is hosting a number of task forces to determine how the spending will be allocated. We had a meeting, I think just this past Friday, the Public Safety Task Force, and it's been a really great opportunity for cross-sector engagement and new ideas to develop, outside of just what the funding will be used for as well. So it could be interesting to have her join us in this group once those decisions are determined by each of the task forces.
Certainly. Thank you for that update, Nina.
That's what I was going to suggest also, Nina. It would be a great opportunity, once everything is finalized from all the groups, to have her come and do an overview of the overall restitution fund, opioid restitution fund, what it means, how the funding comes in, and where we are as of today.
Thank you, Denise. I will take note of those task force. All right, great. Any other questions or any comments about the opioid restitution fund? Specifically asking about this interactive dashboard? All right, and next we have Senate Bill 900, which is the Maryland Behavioral Health Crisis Response System. So I know the Maryland 988, that has been a hot topic for this work group. Many of our members, I know Miss Cheryl and Carlos from TLC at Maryland have been very active in 988 and all of those previous advocacy efforts. So coming across here for 988, this Senate bill now requires the replacement of crisis communication centers with state 988 suicide and crisis lifeline networks in each jurisdiction. So each of these crisis lifeline networks will now serve as the single point of entry for crisis services, coordination with local mental health providers, and direction during emergencies. So again, just something interesting for this work group to take a look at. We've talked a little bit about, what does it look like in the rollout of 988? And this is just, again, another effort, at the state level to bring more cohesion across the state as it relates to 988 and its utilization. Any questions about Senate Bill 900 or about Maryland 988? All right, and next we have House Bill 729. So going back to the opioid restitution fund, this now there were two provisions passed under this House bill, so directly impacting the opioid restitution fund, but then also the overdose response program. So specifically for the opioid restitution fund, this bill now mandates that fund resources can be used and should be used for addressing racial disparities, also disparities in socioeconomic status in terms of limiting access to prevention, harm reduction, treatment, and recovery support services. In terms of the overdose response program, the bill now mandates that more training be expanded with greater emphasis on critical post-overdose care. So there's some additional bullet points that you can all take a look at specifically for this House bill in particular. Again, really interesting as this work group has looked at the intersectionality of health equity and mental health, mental and behavioral health. Something, in particular that we are seeing specific language being named here, that these funds should be used towards addressing racial disparities that we know and have documented here in Prince George's County and really across the state of Maryland. So something that we will be paying attention to, and possibly an additional question to talk to Sammy about in future presentations and future chats about the opioid restitution fund. Any questions, any reactions, or any comments about House Bill 729? Sorry, Lisa, do you have a question or did you just come off mute by accident?
That was by accident.
No worries, just wanted to make sure. Alrighty, so next we have Senate Bill 495. So again, going back to the opioid restitution fund, many new bills and legislation came out giving direction to the opioid restitution fund at the state level. So essentially, this Senate bill aims to expand what the opioid restitution fund can be used for. So it includes more operating expenses and personnel costs, specifically for the Office of the Attorney General. The Office of the Attorney General oversees the opioids enforcement unit, so the OEU, and a new mandate that has come out of the Senate bill is that the Attorney General will now need to provide an annual report detailing the opioid enforcement unit's activities. So that will be something for folks to again pay attention to in terms of the opioid restitution fund, what is being done, the investigations that are taking place, the number of lawsuits filed, and the disposition of lawsuits filed by the General Assembly. And so, as you can see here, that report will be due by October 1st of this year, and then will be due on an annual basis. So again, more information coming to again increase the level of transparency that we are seeing with the opioid restitution fund, and hopefully something that we can pay attention to at the county level as well, and be able to direct any questions that we may have, or see about any information that this work group would like to take a deeper dive at. Any questions, comments, reactions for Senate Bill 495? All right, well, we will move on to Senate Bill 599. So this bill requires the governor to include $5 million to the Behavioral Health Crisis Response Grant Program during fiscal years 27 to 2029. It'll likely there's opportunity for it to be picked back up in 2029, but for now through 2029, we know that that money will now be allocated in the amount of $5 million to within the state annual budget, the annual state budget, to the Behavioral Health Crisis Response Grant Program. Any comments or reactions? Any comments specifically about the Behavioral Health Crisis Response Grant Program here in Prince George's County, and how we project this at the state level impacting us in Prince George's County?
Well, I'll make a comment. This is Gina Greenhood from the LBHA. I mean, to be honest with you, $5 million is not a whole lot of money statewide to continue the expansion and implementation of the crisis response. So I'm just kind of, I don't know what we're going to get for that money. That's the question.
Well, if I might chime in, $5 million, yes, it's not a lot of money, but it's better than not having any additional money at all.
Absolutely. That goes without saying. That goes without saying.
It gives us a measure of confidence that over this upcoming year and several years following, that there's going to at least possibly be that amount that we can depend on.
Yes, and something for us to take a look at further as well. If there would be additional opportunity to take a look at how that $5 million was decided, and to see if there would be future opportunity for advocating for more funds to be able to communicate the importance of this behavioral health crisis response program that we know is very important in Prince George's County, and could certainly always use more funds. Any additional questions or comments? Alrighty, now jumping to House Bill 260. This bill quite simply and to the point reduces penalties for various drug paraphernalia related offenses. So as you can see here, there are some specifics. There's the specific language about fines that cannot exceed certain amounts, and imprisonment that cannot exceed certain amounts. And again, more about those fines that one could receive in the possession of drug paraphernalia. So this is again one that will take effect in the state, taking place on October 1st, 2025. I'll be sure to again include this information for anyone who would like to take a look at more of the nuances, to take a look at some of these fines, and to see how that scheduling would work for those specific offenses. Any questions or comments? All right.
Taylor,
yes.
This is Gina Greenhood from the LBHA again. I'm assuming that does, it's controlled. So I'm assuming that does not include marijuana, correct?
I am going to shake my head yes for right now, but I will have to follow up on that.
Okay, thank you.
Any other questions based off of any of the bills that we've discussed that anyone would like further information on, or a future presentation, maybe from a policy expert? And of course, as you're going through this presentation, please feel free to take any note of any questions that you may have, or any clarity that you would want to receive. I must admit, in going through and trying to read and familiarize myself with all of the bills, the legal jargon can be very confusing, and so trying to boil it down to its meaning and getting clarity there was a bit of a challenge, but certainly will be more than willing to find out more answers for anything that anyone would be interested in exploring more. And this is our last bill that passed that we wanted to highlight today. There were a few more that we haven't mentioned, but for the most part, this was a pretty expansive list of the mental health policies that passed this legislative season, again, here in 2025. But lastly, we have Senate Bill 36. So with this bill calls for more collaborative funding and infrastructure between 988 and 911. So essentially, there is a 911 trust fund, and now this bill mandates that the 911 trust fund cannot specifically fund components of the 988 suicide prevention hotline. They want it to be more of a collaborative approach, that any funding that goes towards 988 to maybe beef up the system or do any software updates or any training opportunities, that would also be shared amongst 911 as well. So it's not all just going to 988, that training and any of those software, all of that is being shared between 911 and 988. So again, more of an opportunity there for more collaboration in terms of funding, as well as infrastructure. And hopefully, coming at this from the mental health perspective and what this work group has been passionate about, just increasing the level of awareness of 988, its importance, and its better integration with 911. Any questions or any comments based on Senate Bill 36? And I will go ahead and open the floor. Were there any bills that anyone was tracking over the legislative season that we didn't mention here today that got passed, or maybe didn't pass, that anyone would like to mention?
Oh, Taylor, this is Larry F. There was one issue that I wanted to bring up, and I don't know how many people just got, the Carillon alert about the four walls regulation that would require all Medicaid patients in Maryland to see a psychiatrist at least once in their care. And I just wondered if others, had a reaction to that. If you look at your email, if you're on the Caroline provider alert, it sort of explains the legislation, but my worry about it would be that it would, greatly increase the cost of care for Medicaid patients, require clinics that are using nurse practitioners to hire psychiatrists, which, go for like $300,000 a year. So it's, just another serious issue. And I just wondered if others, how they're, understanding it.
Larry, we lost you. Those last few words that you mentioned, or that you made, the comments that you made, we didn't hear it
Oh, well,
completely, but okay.
I was just sorry for blabbing on about it. It's just, I mean, I just feel there's so many.
Can I ask you, is this something at the federal level? It has to be.
Yeah, it seemed to
Oh,
derive from a
golly.
federal law that this, I guess the CMS is trying to reinstate. It feels like it's a throwback to 20 years ago when
Yeah,
psychiatrists had to direct the care of all, Medicare and Medicaid patients. So I don't know why they're reinstating this. It also seems to me to contradict independent licensure in Maryland, at least for Medicaid patients, because then their treatment would have to be overseen by a psychiatrist. So I don't know. I just I'm
it's
sort of
weird, but
puzzled by it.
it sounds like it might even uh, uh, result in perhaps Medicaid patients who are being told that in order to keep certain benefits, you're going to have to work. Well, are they going to be responsible for this care if indeed it's going to be mandated? Oh, this is crazy.
Yeah, the Medicaid thing also, I mean, I know that's probably something else, we should all be talking about. I mean, that's another really big headwind that's coming up. So, but let me stop here.
And Larry, would it be possible, do you have any information that you could share in the chat, a link to additional information or a press release or anything? Oops, sorry, you are on mute, Larry.
I'm sorry,
Okay, thank you. Yeah, certainly. If folks, as Larry mentioned, with Medicaid restrictions, if folks would like to follow up next month and continue this discussion, or even organize a bit of a subgroup to have these additional discussion in between our meeting dates, please let us know how we can, best support you and have space to talk about these concerns and talk to you all about how we are navigating these challenges as a health department, and how we can best support our partners across Prince George's County. Any other comments to the four walls legislation that Larry mentioned? And any other additional legislation, whether it be at the state, the federal, the state, or the local level, that anyone would want to bring up or talk about in a future BHAG meeting? All righty. Well, thank you everyone for your attention, for your questions and your reactions to the legislation that did pass in this 2025 legislative season. I would just give a quick caveat again. All of the past legislation that we just reviewed, this was all active during the 2025 policy season. So anytime you are Googling or researching, just make sure that you're always looking up. For example, here it would be Senate Bill 36, Maryland 2025. So you just want to make sure that you are looking at the bill for 2025 and not in 2024, because the bill, if it was brought up in a previous year, it has a new number. So you want to make sure that you are looking up the 2025 legislation. So again, I have a slide here coming at the end that will include a link to the Maryland General Assembly where you can get some more information. I also found a few resources that were able to summarize the policy updates and do a full list of what passed and what didn't pass, because I think, looking at what did pass is just as important as looking at what didn't pass. And so if there are any bills that, again, did pass or didn't pass that anyone would like to take a deeper dive at during a future meeting, please let me know and we can get that added to the agenda. And so with that being said, there were 17 proposed mental health bills that at, again, very different steps of the legislative cycle did not get passed. So they maybe didn't leave a chamber, or they were withdrawn at some point in time. So I won't bore you all with those 17 proposed bills, but I will send them out in the slides so folks can take a deeper dive and again see what didn't pass. And if anything is of future interest to the BHAG, do let me know and we can take a deeper dive. So with that in mind, I just want to close out with some policy resources that you all can review once you receive the slides. Here in our own backyard is the University of Maryland Center for Democracy and Civic Engagement. They have an outstanding Introducing Annapolis 101 training program and curriculum. So if anyone is interested, this is a free resource that is available to anyone across the state who is interested in, again, doing that Policy 101 training to understand the legislative process, how the stages that bills go through to get passed, how they end up at on the governor's desk. Very interesting training, and certainly we can have them talk at a future BHAG meeting if anyone is interested. For the state legislative recap, some of the resources that I used for today's presentation, I've included a link here for a legislative tracker so you can see it in one place, read all the way through, and have it more succinct and be able to take a look at any adjacent links if you'd like to dive deeper into specific policy. And then lastly, of course, the tried and true and tested Maryland General Assembly, where you can search up legislation. You can easily look it up by looking up the Senate or House bill number, and it will take you through the entire process so you can see how it matriculated through the legislative process, ended up on the governor's desk, or if it didn't end up on Governor Moore's desk, to see at what point it died in the legislative season. And then you'll also be able to take a look at the actual filing to see the bills that were filed and be able to see some of the nuances that weren't covered in today's very brief presentation. With that being said, any other questions or comments about the mental health legislation that we went over today? And thank you, Larry. I see you put here in the chat this PDF. I will be sure to include this in our meeting notes for folks to take a look at the rider alert. Alrighty, well, let's go ahead and jump into our meeting or community announcements so we can go ahead and wrap up. So excited to announce from our local behavioral health authority. Again, as I mentioned, the LBHA, they oversee that suicide prevention and education a group. And so their coalition is hosting this suicide prevention and awareness forum taking place on Friday, June 27th. You can see the address there, taking place in Greenbelt from 9 a.m. to 2 p.m. So I will be sure to include this flyer to folks in the meeting notes if anyone is interested in attending. And please, please, please share this with your networks. It's going to be a very important day to gather together as a county and talk about suicide prevention and awareness efforts. Next, any of our nonprofit partners who may be interested in applying for a county council non-departmental grant, do take note that the letter of consideration is due no later than Thursday, July 3rd. So again, if any of our nonprofit partners are interested, you can submit a letter of consideration. It should be no more than 2 pages. And they have some very specific criteria that they want you to follow when applying to the county council for a non-departmental grant. So if you are interested, I will be sure to get this flyer out, send it to anyone who may be interested in pursuing this opportunity as well. You can also take a look on the county council's website to see past programs and past organizations that the council has funded. So if you have any questions, again, there is this link here from the county council so you can view more information about the requirements and to see if your organization is eligible. Next, coming from the Maryland Commission on Public Health, they are asking for feedback by July 9th at this QR code. Again, I will be sure to include this in our meeting notes. There are several work groups that have worked again at the state level. There are 5 content specific groupings that have different recommendations that the commission has made and that they would like public feedback on. So you'll go on, if you go to that Google link there, the link that this QR code will take you to, you'll be able to read through more of their recommendations and offer any feedback. Again, the topics vary from the different work groups. There's a data work group, there are other work groups, so you can take a look at their formal recommendations and offer any feedback that you may have. And that was the last community announcement on our end. Does anyone have any announcements that they would like to make or any upcoming events? Dr. Wiggum, I see your hand. You are still muted if you're attempting to speak right now.
Sorry about that. I had to go to my phone because I'm having trouble with my laptop and it doesn't unmute me. I just wanted to mention, well, first, good afternoon, everyone. I just wanted to mention that the Health Department Behavioral Health Division is going to offer 2 SAMHSA trainings in providing trauma-informed responses. And this has a strong focus on working with justice-involved individuals, but the training is applicable to working with any client. There will be 2 trainings. One on Thursday, June 26th, second on Friday, June 27th, both are from 10 to 3, and they'll be in Largo, Maryland, and I can put the details in the chat.
Thank you so much, Dr. Wiggum.
You're welcome.
See here. Alicia, I do not have power. I'm not able to unmute you. I do apologize for that. But would you like to put your announcement in the chat and we can get it out in the meeting notes? Any additional community announcements? Alrighty. Well, on a more personal note, I do just want to quickly announce this is my last BHAG meeting facilitating. This will be my last month with the coalition. I am stepping away to a new position with the health department. So I look forward to seeing what this work group continues to do. When I came onto the coalition 2 years ago with the health department, the BHAG was actually my first task. I was tasked with facilitating this work group, and it has just been such a wonderful 2 years. I am so proud of the success that we've had in the past 2 years, just building up the network, building up this continuum of care across Prince George's County. So it has just been an honor of a lifetime. I've always just felt the deepest connection to my behavioral health folks. Like I mentioned, you guys were my first work group that I got to work with. So I thank you all for your patience, for showing up month to month. You have weathered many transitions with the health department, and you've always come just so energetic to participate in these monthly calls. And I appreciate you all volunteering so much just to create a better community for everyone to thrive. So thank you all so very much for everything that you've given this work group. I look forward to seeing what you all do in the future. There will be new leadership coming over the summer, so do not fear. We will make sure that things continue to move as smoothly as possible and that the work groups are not interrupted in any way, shape, or form. And I will certainly see you all in other outings and within the work group as well. I will try to come to as many meetings as I can to stay up to date with what my behavioral health folks are doing. But again, thank you so much for all that you do. And I hope you all have the most wonderful summer break. And I hope you all continue to take good care. My email address isn't changing, so if you all need anything, you know how to reach me. And I am happy to still coordinate and collaborate with you all however we can. So thank you all very much. And I hope you all have a wonderful rest of your week. Stay dry and happy Juneteenth to everyone. And the BHAG will convene next on Wednesday, July 16th. But if you need anything in the meantime, you know how to reach me. But everyone, take good care and thank you so much.
Thank you, Taylor.
Thank you, everyone.